Hi everybody, in this video we are going to discuss about the viral disease. And one of the very important and common disease with which everybody is infected is the common cold. Okay, so we are going to discuss about the common cold now. Okay, the name of the disease which we are going to discuss is common cold. Otherwise, it is also called as the rhinitis. Okay, it is also called as rhinitis. And this particular disease is caused by the virus. So what is the virus that is causing? So we know that the disease causing microbe is called as the pathogen. So the pathogen that causes this common cold is a group of viruses called as what? Rhinoviruses. A group of viruses called as rhinoviruses, which is of just about 30 nanometers in diameter. It is a very small virus that attacks and causes common cold. Okay, that attacks and causes this particular disease called as the common cold. So rhinovirus, these are a group of viruses which causes the common cold. It is of just a very small size of about 30 nanometers in diameter. And this particular rhinoviruses, okay, it is belong to genus. Okay, it belongs to genus called as enterovirus. It belongs to a genus called as enterovirus, and the family to which it belongs is called as Picornaviridae. Okay, Picornaviridae. Okay, to this family this particular virus belongs to. Okay, this particular virus belongs to, and this virus will be infecting the nose and the respiratory passage. Nose and respiratory passage is infected by this particular pathogen, causing what? Common cold. And please remember, it is attacking or infecting nose and respiratory passage, but not lungs. Okay, but not lungs. It is not infecting what? Lungs. Okay, but not lungs. So you have to remember, it is not infecting the lungs, but only the nose and respiratory passage. So you have to remember which part is being infected with the rhinoviruses causing common cold. Otherwise called as what? Rhinitis. Okay, it is the nose and respiratory passage but not lungs. And how it is transmitted? How it is transmitted from one person to another person. So here if you are looking at the mode of transmission, it is from the inhalation of droplets. When an infected person coughs or sneezes, okay, when an infected person coughs or sneezes, these particles that are coming out of his mouth will be spreaded to almost about a short distance, about 3 meters. And these droplets, when they are inhaled by a healthy person, there are chances that these droplets will be containing what? The rhinoviruses, and because of these particular pathogen present in the air, which are inhaled by a healthy person, and they enter into the healthy person and can cause the common cold. So by the inhalation of droplets, by what? By cough or sneeze. Okay, by cough or sneezes, the person may be infected. Or otherwise, contaminated objects means what? When a person is suffering with this particular disease called as the common cold, if he is continuously touching his nose, mouth or eyes, okay, he is contaminated, his hands are contaminated with this particular pathogen called as rhinovirus. And this person, when he touches any object for that matter, okay, contaminated objects means now wherever or whichever the object he touches, it may be a pen, it may be books or cups, doorknobs, computer keyboard or mouse of the keyboard. When he touches or when he or she touches suffering with what? Common cold, there are chances that this particular rhinovirus is also now present on these, and these objects are called as what now? Contaminated objects. These objects are now containing what on their surface? Rhinovirus. And when a healthy person comes and touches it, that person also will be suffering with that disease, okay, called as common cold. And now if you are looking at the incubation period, it is about 3 to 7 days. So here the incubation period is about 3 to 7 days. 3 to 7 days, and this disease lasts for only about, we can say that it will be lasting for about 7 days. In some people, it may be for a long period of time. It may be for long period of time, but actually it may be lasting for 7 days. Last for 7 days. And signs and symptoms. What are the signs and symptoms of common cold? That particular person who is suffering with the common cold will be having nasal congestion. Okay, nasal congestion, and also discharge. Nasal congestion and discharge, sore throat and tiredness. He feels tiredness, hoarseness in his voice, cough and headache. Okay, these are all the signs and symptoms to say that that particular individual is suffering with what? Common cold. Is suffering with common cold. And some other important points that we have to remember is that when we are talking about this particular disease, remember that this is a viral disease, and that's why very important thing that we have to remember is that there is no vaccine for this particular disease. There is no vaccine that is being identified or discovered for this particular disease. Okay, for this particular disease. This disease is there common from the year 1950s. From 1950s, this has been seen attacking many people. Okay, many thousands and millions and billions of people are being attacked by this common cold. But there is no vaccine that is being discovered for this particular disease. Okay, for this particular disease. And this particular disease is a contagious disease which will be spreading generally in autumn and winter. In autumn and winter, and remains active outside the body for about 3 hours. This particular virus will be active outside the body for about 3 hours, and once it enters inside into the body, first 3 days it will be very severe. First 3 days it will be severe, and slowly it starts decreasing or reducing. Okay, the symptoms and signs will be reducing. And why it will reduce means, please remember, this disease will be generally cured by their own natural immune system. Our own natural immune system will be fighting against this particular virus and tries to destroy this particular virus. But there is no particular vaccine that is being discovered for this particular disease. And if you are seeing, this particular virus will be multiplying more, or proliferation means proliferates means what? Multiplies. This particular virus will be multiplying more at a temperature of 33 to 35 degrees Celsius, okay, or centigrade. 33 to 35 degrees centigrade. At this particular temperature Celsius, it will be multiplying rapidly. The same thing if it is in Fahrenheit, 91 to 95 degrees Fahrenheit. This is the most favorable temperature for this particular virus to multiply. And more common, or the best temperature or favorable condition is at 32 degrees Fahrenheit. Okay, 32 degrees Fahrenheit. And this is being maintained. We know, let me say like this, our body temperature is about what? 37 degrees. Okay, 37 degrees Celsius we say. Or otherwise we say it as 98 degrees Fahrenheit we say. 98 degrees Fahrenheit. But this particular virus will be showing more proliferation at 32 degrees Celsius, means our nose, which is in close contact with the environment, will be maintaining less temperature, and maybe it will be maintaining 32 degrees Celsius. So that's why it will be more multiplying, attacking the nose and the respiratory passage. So here, these points we have to remember when we talk about the viral disease called as the common cold. And whenever we are suffering with this particular disease, always we should wash our hands thoroughly. We have to wash our hands, and we should not touch our nose, mouth or eyes directly with our hands. Direct contact of our hands with our nose, eyes and mouth should be avoided. And in hospitals, they will be providing masks to wear when we are coming in contact with what? The person who is suffering with common cold. So here you have to remember all these points to know, to understand about the particular disease called as common cold, that is known as the rhinitis. Okay, the other name is rhinitis. So these are the points which we should keep in mind when we discuss about the viral disease. Thank you so much.